I am a pediatric emergency medicine attending at Cohen Children's Medical Center. I've been there for close to about 15 years. In high school, science and math was always my favorite thing, and I felt like that's what I excelled in. So I think I knew from a young age, was kind of determining whether I actually was going to be a vet or a physician. The appendix at a later date is what they usually do, all right? When it's ruptured, they don't always usually go to the operating room right away. Kind of got to let it smolder with the antibiotics and get her feeling better and more stable. Okay, all right? My father, when I was younger, was ill a lot, so I was in the hospital with him even when I was younger, and then I was in high school, so I was around a lot of physicians. I, saw how they helped him. So I think that was one of the things that probably, made me see that I wanted to go into medicine.
You have a phone call on 7640, Dr. Giroux, 7640.
Okay. Shine it.
And who has 12?
You're on.
I tell my trainer that she's my therapist because I don't have to go to a therapist because I can come and I ride. That's one of the ways that I got over the loss of my father. He loved horses, but I miss him every day, and I was very close to him. But sometimes when I'm here, I feel like I'm with him. He was somebody that I would always call up, and if I had a hard day at work, and when I was a resident or I was an attending and there was a difficult situation with a patient, even though he wasn't in the medical profession, I would just sit and talk with him. So I miss that, because he would help me with the stress of, everyday occurrences. Hi, how are you? I'm Dr. Crevi. I heard we hurt our arm. When you come in every day, you really don't know what you're going to be seeing. That to me is the good thing and the scariest thing about emergency medicine, that every day you walk in, you could have a calm day and the majority of your patients just need breathing treatments, or you could have 5 traumas come in who are severely ill and need to go to the intensive care units. You never know what's going to come in on a day-to-day basis. Sophia, can you sit up for me, hon?
You gotta sit up, just look at the doctor.
I'm gonna take a look at you. How has she been feeling about her throat? Can I see in your mouth? Okay, big ah for me. Big one, say ah. So when I first get to work, I usually go and find the attending physician that was on for the day, and we gather the residents and the fellows and the medical students together. So we go from bedside to bedside, see if the families have any questions, and then we talk about the patient and what their plan's going to be from then on. When I see a patient that's severely ill and things are not going right, or not necessarily going right, but they're getting worse, it's a very scary situation. Your adrenaline, everybody on the team's adrenaline starts to rush. You don't want to lose this patient. You see the anxiety, obviously, in the parent's face. And definitely my heart's racing. You're trying to do the right thing. But there's obviously some situations where you do the best that you can and the outcome is not good. And that's always very upsetting. You have to take a little time to yourself. Sometimes you talk with the family, try to compose yourself with the family, but then you walk away and you're obviously going to shed a little tear, hug the nurses, hug your staff. It's always very difficult. Let's take a look at you, sweetie, okay? I know your belly's hurting you a lot. Unfortunately, I've had a lot of loss in my family, and but I think sometimes it helps me to understand families a little better and what they're going through. I have 2 children, a 14-year-old daughter and a 16-year-old son. I can see from the other side how difficult it is in going through that. You never want to see your own child in pain, so you can understand when somebody comes in, and even if it's something minor, they're not in the medical profession, so you may see it as that it's something you can easily take care of and they're going to do fine, but they don't really understand. Even a laceration or a cut, the child's going to be very upset, the parent's going to be very upset. When my son was younger, he fell and he had a little laceration on his head, and I knew it was very minor. I got so upset. So I totally have walked in their shoes, and I understand that.
The doctor and the nurses were great. They did the best to try to distract me and try to get rid of the pain.
Even when you're having a stressful day, when you have a really playful child that does well, you're able to discharge, and they come up and they say, "Doctor, I drew you a picture," and they hand you a little picture. That just makes your day. That makes your week.
I want to be a doctor because I could help kids feel better.
My father always wanted me to be a physician. You know, that's part of the reason that I do the job, is to see those patients getting better and get released. I loved my father dearly, and when I lost him, it was tough. And yes, I think that he would be. I think he was always proud of me. I think that's what pushed me. I always wanted to make him proud.